Good morning, WellStar, and thank you for joining our COVID-19 Vaccine and Women's Health Town Hall. During our time today, we look forward to sharing the latest recommendations with you and answering your questions surrounding vaccinations and women's health. We have assembled a panel of WellStar experts who will help us answer some of the top questions we have received from team members across the system regarding the COVID-19 vaccines. We're here to help separate myths from facts and get factual information from reliable sources. I'm Samantha Greiner, Assistant Vice President for Women's Health, and will be moderating today's discussion. Joining us are Dr. Paula Greaves, WellStar's Chief Women's Health Officer and practicing OBGYN with WellStar Medical Group. Dr. Ashley Teagues, practicing reproductive endocrinology and infertility specialist with the Atlanta Center for Reproductive Medicine and new mom who was breastfeeding when vaccinated. Dr. Shivika Trivedi, practicing OBGYN with WellStar Graduate Medical Education and new mom who was vaccinated during her pregnancy. Michelle Riggs, international board certified lactation consultant and breastfeeding expert. And Dr. Rhonda Wachsmuth, practicing breast surgeon and breast cancer expert with Georgia Breast Care. Dr. Greaves, as our Chief Women's Health Officer, would you walk us through the 5 myths related to the COVID-19 vaccine and women's health topics we will be discussing today?
Good morning. I'm excited about having this town hall. Hopefully by addressing these myths and misinformations, we will remove barriers that prevent COVID vaccination in our community, and we can eradicate this pandemic. So the myths that we are going to discuss today are: the COVID vaccine does not work for women or will harm me. The COVID vaccine will affect my fertility or chances of getting pregnant in the future. The COVID vaccine will harm me or my baby during pregnancy. The COVID vaccine will harm me or my baby during breastfeeding. And last, the COVID vaccine will give me breast cancer or other cancers.
Thank you, Dr. Greaves. For starters, can you help our audience understand the 2 types of COVID-19 vaccines and how they work?
So first of all, I'm gonna, let's name our enemy. Severe acute respiratory syndrome 2, coronavirus, or COVID-19. This is the name of the devastating virus that has plagued our world for over a year. In order to understand how to fight this plague or fight this virus, we need to understand how the virus works. The virus has on its surface spikes that are spike proteins. That's why the virus is called coronavirus. Corona means crown. The purpose of that spike protein is to break down our cells and gain entrance into our body, and then produce the syndrome of attack of all of the different systems in our body. Scientists then realized that in order to fight the effect of this virus in our body, we needed to develop a way for our body to recognize that spike protein and then create a resistance so that that spike protein would not enter the cells. So that is basically what we have done. So there are 2 types of proteins of vaccines. The first one is called mRNA, messenger RNA, and the second type of virus is the viral vaccine is called the viral vector vaccines. They both have the same purpose. The mRNA is just a messenger. It's not DNA. It cannot alter our cells. It simply is placed in an envelope, and it then goes to the cells and delivers a message to the cell to make these spike proteins. Once those proteins are made by our cells, our body then recognizes that they are not part of our system and creates antibodies against the spike proteins. The viral vector vaccines have a similar function. They use a very harmless adenovirus, as the virus found in a common cold. It uses that as a vector or a vehicle and places the information that goes to our cells in order for our cells then to make the spike protein. Our bodies react to that by creating antibodies against the spike proteins. The end result is our bodies then mount an immune response. And the next time we see the real coronavirus presented to us, we will then resist by creating antibodies against the virus. So that's the way that both type of vaccines work.
So Dr. Greaves, could either type of vaccine give me COVID-19?
No, none of our vaccines use COVID viral particles. They're unable to give us COVID. In addition to that, none of these vaccines are able to cause change in our DNA.
That's really great news. Does the vaccine prevent catching COVID-19 or reduce future symptoms?
Yes, the vaccines have been shown to be at least 90% effective in preventing COVID disease, especially the mRNA vaccines. They're 94 to 95% effective in preventing COVID vaccine. Most of the virus are effective in preventing death or hospitalization. And it also helps to reduce, if we are exposed, the symptoms are very mild, if any.
So those are some of the benefits for the vaccine. Are there others, and are there side effects to getting the vaccine?
Side effects of the vaccine are to be expected, like any other vaccine, and they involve side effects that could be mild, such as low-grade fever, chills, joint pain, sometimes lymph nodes. Rarely, and that is a 0.001% of the time, patients will have an anaphylactic reaction or a severe reaction to the vaccine. And that's the reason why when vaccines are given to us, for the first 15 minutes, every single person is monitored to make sure that they don't develop an anaphylactic reaction. And if that happens, in that very rare event that it happens, providers are there to help treat it.
So we've heard a lot about the clinical trials around these. Were women included in those trials, or have the vaccines been endorsed by OBGYNs?
Women were included in the trials, and at this point, millions of women have received the vaccine, and it has been successful. OBGYNs and providers in general have all endorsed the vaccine, and societies such as the American College of OBGYN, the Society of Maternal Fetal Medicine, societies for infertility, for reproductive medicine, lactation, and Society for Breast Imaging, they have all endorsed women and the population in general receiving this life-saving vaccine.
Will the vaccine give me long-term immunity?
The studies are still underway. Thus far, it has been shown that it is providing at least 6 months of immunity. And so there is the probability that we will have immunity up to 1 year and that we will have to get a booster in the future. Many other vaccines that we have had throughout our lives require a booster, so this is not unusual.
Thank you for explaining that detailed information. Dr. Greaves, to summarize, what would you say in response to the myth the vaccine doesn't work for women or will harm them?
The vaccine works for everyone, including women. The vaccine is a life changer for being able to survive this pandemic. The vaccine is safe, especially for women that are childbearing age, pregnant, or lactating.
Thank you, Dr. Greaves. To discuss the effects of the vaccine on fertility as our second myth, please welcome Dr. Teagues. Dr. Teagues, can you help us understand the myth that the COVID-19 vaccine causes infertility for women?
Yes, thank you, Samantha, so much for having me here, and I really appreciate this opportunity. This is a myth that has become pervasive in social media, on the internet, and I would really like to address that this is a myth. The COVID vaccine that the COVID vaccine causes infertility. I would first like to start with saying that there's no biologically or physiologically plausible way for the vaccine to cause or impact infertility. So the reason that this myth started, and I would really like to talk about this for a minute, to talk about the supposed origins of this myth. There was an article posted on a blog, I believe it was called Health and Money News, by 2 Europeans, and this article has since been taken down because the authors acknowledged that it was not true, but they did suggest that the spike protein that we create antibodies to when we receive the COVID vaccine, as Dr. Greaves so eloquently discussed, that spike protein is similar to, there is a spike protein in the human placenta called syncytin-1. However, and so the theory was that this could cause infertility. We would create antibodies to syncytin-1. However, those authors have acknowledged that this is not true. This syncytin-1 is a type of spike protein, but it is very different. And so the COVID vaccine does not cause antibodies to syncytin-1 and therefore cannot impact our placentas or impact our fertility in any way. There's been no loss of fertility that has been reported among clinical trial participants or among the millions of women who have received the vaccines, nor have any signs of infertility appeared in animal studies. The CDC, as many of you know, launched an app, the theyve app, which is an app that allows participants to self-report their symptoms after receiving the vaccine. And over 44,000 women who are pregnant or became pregnant have been enrolled in this app, and they have not reported any increase in adverse outcomes as compared to their non-pregnant counterparts. And then finally, as of February 19th, so this data is probably much more updated, but the most up-to-date data I have is of mid-February. There were 275 completed pregnancies reported through that app, and 232 live births. And actually, there was a decreased incidence of stillbirth, miscarriage, intrauterine growth restriction, preeclampsia, eclampsia, and other obstetric complications in women who received the vaccine while pregnant or trying to conceive, as compared to their counterparts who did not get the vaccine. So that is very encouraging information.
Thank you, Dr. Teeks. That's a lot of documented pregnancies after receiving the COVID vaccine. Are there any modern vaccines that have caused infertility?
We do not know of any modern vaccines that have caused infertility. There's no plausible way that the vaccine and its mechanism of action, either of the vaccines that are released, can alter DNA or change our hormones or impact fertility.
So this is not unusual. That's great to know. Should anyone delay trying to conceive due to getting the vaccine?
There's no reason to delay conception. It is not a live vaccine, and so it is unlike other live vaccines like MMR or varicella vaccine, where a delay is required. That is not the same for COVID-19 vaccine.
Thank you. So to summarize, what would you say to the myth the COVID-19 vaccine will affect my fertility or chances of getting pregnant in the future?
I would say that any patient attempting to conceive or is pregnant should absolutely get the vaccine. All the available data that we have suggests it is effective and safe and will not impact fertility or pregnancy.
Thank you, Dr. Teeks. That's a great segue into our third myth. So let's move on to discuss that one, pregnancy as it relates to the vaccine. Dr. Trivedi, you were pregnant during the pandemic. As an OBGYN and an expectant mother, how did you navigate your decision to get vaccinated?
Thank you, Samantha. I'm so happy to be here and so happy to talk about my personal decision as well as my professional opinion about the vaccine. So as soon as I found out that the vaccine was even available, I left clinic and got coverage and came down to Kennestone so I could get my vaccine. My hope and goal had been to be able to get both vaccinations of the Pfizer vaccine as soon as possible, and ideally 2 weeks before delivery so that I would have the maximum amount of antibodies in my system before my baby was born. As an OBGYN taking care of moms at Kennestone, I was heartbroken watching moms getting sick with COVID. Young, healthy moms who otherwise would have had healthy pregnancies, who now were ending up hospitalized in the ICU, intubated, or even having to be delivered emergently and prematurely. As we were able to increase our testing, we saw increasing numbers of moms who were asymptomatic but testing positive for COVID and who had to make the difficult decisions about quarantining away from their new babies or having to kiss their newborns through a mask. There was no choice for me. I knew that I needed to get the vaccine as quickly as possible, and I consider myself lucky for having had that opportunity and thank Wells for making that opportunity available to me. As an early adopter of the vaccine, I knew that there was a risk of side effects and that there was little information about the safety of vaccines in pregnancy. But I also knew that my risk of being exposed to the virus at work was far greater than any risk that the vaccine posed, and also had seen firsthand again the risks of pregnant women getting infected with the virus. No vaccines have ever been tested in pregnant women, and the COVID vaccine was no different. However, understanding the science behind how the vaccine works was reassuring to me. And that was a discussion that I have now had with multiple of my patients and would encourage anyone listening to also have with their own providers. Where we are now, however, is far different from when I had decided to get the vaccine. Since the vaccination rollout was initiated, there's been a lot of evidence that's accumulated from pregnant moms who were vaccinated during their pregnancy. We have a lot of safety data on the vaccine in pregnancy and also safety data for the unborn child. Information is continuing to be collected by the CDC and the University of Washington about these moms and their babies, and I consider myself, again, lucky to have been able to get the vaccine for my own protection and the protection of my newborn.
So Dr. Trivedi, can a baby be born with antibodies that will protect them from COVID-19?
Absolutely. So the latest data that has come out has shown that in the umbilical cord, when the cord blood was tested, so that's blood that right in the moment of delivery is going from the mom to the baby, that there is evidence of antibodies against COVID infection in that blood going straight from mom to baby. And so it's truly the best gift that you can give to your newborn during these very difficult times, to bring them into a world with the protection against a virus that we're still trying to understand.
That is great news. Is there a specific trimester or time frame women should be vaccinated?
As soon as possible, yesterday if possible. The sooner, actually the latest information from the American College of Obstetrics and Gynecology has shown that women do better and have a larger amount of antibodies in their body the earlier in pregnancy that they get pregnant. And so we encourage women, if they're, like Dr. Teague said, if they're considering pregnancy, that is the time to get it. If they're already pregnant, that is the time to get it. If they're about to deliver, that is the time to get it. Wherever you are, that's when you should be getting the vaccine.
That is a very clear answer and a great endorsement. Thank you, Dr. Trivedi. To summarize, what is the recommendation for pregnant women and the vaccination, and how would you respond to the myth the COVID-19 vaccine will harm me or my baby during pregnancy?
The myth is completely false. If there is anything to be said, it's actually the exact opposite. The best thing that you can do for yourself to take care of yourself and your unborn child is to get vaccinated as soon as possible, to make sure that you are able to fight off any virus that you may be encountering either at work, working at Kennestone, or in the community, and also to make sure that your newborn has the ability to fight off that virus coming into this world.
Thank you, Dr. Trivedi. I'm so glad you and your baby have that protection. Now we're going to move on to the breastfeeding myth. So please welcome Michelle Riggs, an international board-certified lactation consultant, to discuss how the vaccine impacts breastfeeding for a mother and baby after they're born. Michelle, is it safe for a mother who's breastfeeding to get the vaccine?
So thank you so much for having me participate in the panel. It's always exciting for me to be able to talk about breastfeeding, since that's definitely my passion. So yes, it's absolutely safe for a mother to choose to be vaccinated with the COVID vaccine if she is a breastfeeding mother. We actually see that when a mother is vaccinated, she actually produces antibodies for that vaccination and is able to provide that through her breast milk to her baby. So an immunization can be extremely helpful, and the latest research is extremely positive and very promising with what we're beginning to see.
That sounds really promising. So how do those antibodies pass to the baby in breast milk?
You know, it's interesting. Breast milk is one of those amazing properties that a mother can make. We often tell mothers, if you're going to be sending your little one to daycare, sit in that daycare and nurse your baby, because when you do that, you actually are immunizing your baby, if you will, with antibodies. This is no different when you're breastfeeding your baby, whether you have contracted the COVID virus or you are now being vaccinated for the virus. Your body responds by making antibodies for that virus. And each time that you nurse your baby, you are adding protection to that baby. And that's a very important thing. Breast milk is one of those amazing dynamic substances. Like I said, it changes hour by hour. It changes day by day. So the two women who give birth at the same time, at the same place, have very different milk from each other. That milk is not only species specific, it is specific for that mother and for that baby. It's a dynamic, changing, living tissue. It is so important to provide those antibodies to the baby so that you're neutralizing any effects of that the virus or any viruses may have with exposure.
Wow, what a powerful substance. So is it safe for a mother who tested positive with COVID-19 to breastfeed them?
Absolutely, it's safe for a mother to breastfeed. Matter of fact, we encourage that so that, again, you're protecting that baby. So keep in mind, when a mother does present positive with the COVID virus, it's important for her to, before she handles her baby, she's washing her hands, she's making sure that she wears a mask, that the mask is covering both the nose and the mouth, that she is not touching her eyes or her nose or her mouth, nor her baby's nose or mouth or eyes. And so wearing that mask in place and then feeding her baby. When she's done, she is, again, encouraged to wash hands, wash surfaces so that those are clean and free of germs. If the mom decides that she wants to pump her breast milk, that's fine. We encourage her to then wash her pump pieces, make sure that that's washed in hot soapy water or run through the dishwasher on a hot cycle, and then air dry those pieces. So
thank you, Michelle. Are those antibodies equally present in breastfed babies whose mothers have been vaccinated and mothers who contracted the virus naturally?
Yes, and that's what's so exciting, of course. And we know this from watching other viruses, looking at flus and other infections and so forth. But whether the mom contracted the virus or she's been vaccinated, she will equally produce those antibodies and thus protect her baby. So, and it's very quick, an exposure to a virus tells that body to immediately bring up those antibodies. And like Dr. Greaves had mentioned, there is protection that can last up to 6 months from what we have seen. So very exciting information. Obviously, more research is needed to be done since no lactating women were part of the trials for the vaccination. But what we're seeing is so promising and very, very exciting.
That's great news, Michelle. To summarize, how would you respond to the myth that COVID-19 vaccine will harm me or my baby during breastfeeding?
So again, we have this clear evidence that COVID vaccines can induce immunity and will protect our infants. We have so much information available to us. We have to be sure that we buffer that information that we're getting, whether it's from our phones or from the internet or from Facebook. We have to buffer that with trusted, sound medical advice talk to your provider, talk to your healthcare provider, make sure you're asking the questions. If you're unsure about that, have that conversation and make sure that you feel that you have the trusted, researched information before you look at the other information that you're presented with.
Thank you, Michelle. I love the reminder to talk to your provider if you have medical questions. That's a really important point to make. So we'll shift to our final myth for the day. Dr. Rhonda Walksmooth is here to talk to us about the myths surrounding the COVID-19 vaccine and any correlations with cancer. Dr. Walksmooth, has there been any correlation to cancer and the COVID-19 vaccine?
Good morning, and I'd like to thank you, Samantha, and WellStar Health System for inviting me here. There has been absolutely no correlation between COVID-19 vaccine and cancer, and in fact, there's no correlation between any vaccine and cancer. To try to figure out where this myth might have started, I did do some research, and the only thing I could find is that polio vaccine in 1960s was contaminated with a simian virus, which did cause tumors in mice. And so there was some concern that people who had received this polio vaccine would develop cancers. That has been disproven. No one who received that polio vaccine that was contaminated developed cancer. So there is really no evidence for this.
That's really important to know, and the history behind that as well. 1960 is a long time ago, so I'm glad we made a lot of advances since then. If I haven't gotten a mammogram yet this year, when should I get it? And does getting the vaccine impact when I should schedule my mammogram?
So this is another area that has contributed somewhat to this myth of cancer and the COVID-19 vaccine. Receiving the COVID-19 vaccine can result in some swollen lymph nodes on the side, typically where you receive the vaccine. Swollen lymph nodes identified on mammogram can be, rarely, a sign of breast cancer. So there has been concern that if you are vaccinated and you have your mammogram, that these swollen lymph nodes will show up and that it will cause a problem as far as differentiating between reactive lymph nodes versus breast cancer. I would say that we are far more sophisticated than that. We can differentiate between reactive lymph nodes and cancerous lymph nodes. I do think that if you're just ready to schedule your screening mammogram and you can wait 4 to 6 weeks after your second vaccine, by all means do it. But I would not alter being vaccinated or taking care of my breasts because of that fear. It is really unwarranted.
That's an important point. Getting the vaccine and getting a mammogram are both important for your health. Do I need to let my mammographer know if I've gotten the vaccine?
Absolutely. And you should tell them which arm you received the vaccine in, and that will help us if we see some lymph nodes on that mammogram to consider that they are likely reactive to the vaccine.
That's really good to know. If I have a history of breast cancer, do I need to get the COVID vaccine?
Absolutely. I encourage all of my patients to be vaccinated, particularly patients who have had breast cancer. COVID is not a disease that anybody wants. So I believe that we should have our vaccination. I do not think it at all negatively impacts our health.
That is a great summary, Dr. Walksmooth. What would you say to the myth the COVID-19 vaccine will give me breast or other cancers?
I would just say that that is absolutely a myth and is based on no data whatsoever.
Thank you. So thank you all for being our expert panelists. We really appreciated hearing your individual perspectives. Before we begin to answer additional questions from our chat box, could each of you share why you have taken the vaccine specifically? Dr. Greaves.
I think that leaders need to model the way. We do have fears just like the rest of the population, and I feel that after we have studied the science, we need to feel the fear and do it anyway. I decided to do that because my family, my friends, my community, and my patients were watching to see what I would do. And I want to end this pandemic, and the only way to do it is being an active participant in developing herd immunity, and a way to end this pandemic is to get vaccinated. So feel the fear and do it anyway. The science is real.
Thank you, Dr. Greaves. Dr. Teagues, why did you get the vaccine?
I received the vaccine to, just like Dr. Greaves, to protect my patients, my family. I knew this was the only way to protect my patients and my family working every single day, and also to end the pandemic. I have to be an active participant. I completely agree with Dr. Greaves. That's very well said. And also I was breastfeeding my baby at the time, and I knew that my baby would really only reap benefits, as I know from what science has taught me over the years, that my antibodies are passed through breast milk to the baby, and there could only be benefits there.
That's really powerful. Thank you, Dr. Teagues. Dr. Trivedi, why did you get the vaccine?
As an OBGYN, seeing moms getting sicker and sicker from the COVID vaccine, from the COVID infection, and then myself being pregnant, I knew that I needed to take this step to protect myself and my baby and protect my toddler at home, so I wasn't bringing home an infection to anybody else in my family or in my community. And so that's why, as soon as it was available, I went ahead, and now have been reassured by the increasing amount of information that is coming out about the safety of the vaccine in pregnancy and for newborns.
Protecting little ones is a great reason. Thank you, Dr. Trivedi and Dr. Teagues. Michelle, what is your why for taking the vaccine?
You know, I have a mother-in-law that's 93 years old, and my father, who just turned 91. It is very important for me to still remain a part of their lives. And the best way that I can do that is to be vaccinated so that I can protect them from any exposure. I also have 6 grandchildren, and one of which was born prematurely. So it is very important to me. And when my daughter recently asked me whether she should receive the vaccine, and she's breastfeeding, I highly encouraged her to do so.
Great plan. Thank you, Michelle. I hope your mother-in-law and your dad got the vaccine and are doing well as well. And Dr. Rocksmith, why did you get the vaccine? What is your why?
My why may be a little more selfish. Like most doctors, I am not a good sick person. I do not like to be sick. I take the flu vaccine. So I took the COVID-19 vaccine so that I wouldn't get sick. But it is also because my patients depend on me. I take care of women who are immune compromised, breast cancer patients who are receiving chemotherapy. And I just felt like I needed to do that in order to continue taking care of these patients and live a healthy life.
Thank you, Dr. Rocksmith. Your why is a lot like mine. I chose to get the vaccine because I wanted to protect everyone around me, including myself, in the future. After seeing what happened to our COVID-19 patients over the winter, I knew I did not want to be in that cohort. And anything I can do to protect against that is well worthwhile. So our first questions are now starting to come in from the chat box. Thank you everyone who is submitting questions for the panel. One of our first questions is to Dr. Greaves. Dr. Greaves, should a woman who has already had COVID-19 get vaccinated?
Absolutely, yes. And there are 2 scenarios. So if a woman already had COVID, the recommendation used to be to wait at least a month or 90 days. But the CDC has recently reported that as long as a person is out of isolation, around 14 days, they're okay to get the vaccine. Also, you should not delay past 90 days to get the vaccine because there's a little bit of immunity after getting the virus. The second scenario is, and someone may ask, I got the vaccine, developed COVID. What should I do? So remember, the first vaccine only confers around 54% immunity. As soon as one is out of isolation, within 14 days, you should get the second dose. So wait 14 days and get the second dose. Do not delay.
So thank you, Dr. Greaves. That is really important information. We also have a lot of questions coming in about recommending one vaccine over the other, specifically women. What do you think?
I think that as long as there's not a known allergy to the components of the vaccine, and for the mRNA vaccine, the component is polyethylene glycol. That is usually the component that causes a reaction. If you have no known reaction to that component, I do not have a preference of one, Pfizer versus Moderna.
Good to know, and we are giving both here at WellStar to both our patients and our employees. So we're also seeing a lot of questions for Dr. Teagues. Dr. Teagues, how can we know fertility and pregnancy is not negatively affected by the vaccine if we don't have any long-term data?
That's a great question. I get asked this all the time. And this comes up a lot because pregnant women were excluded from those initial trials. However, many women became pregnant while they were in the trial, and so we do have mounting data, and we're getting more data all the time. And remember, we actually do have other data on mRNA vaccines. So mRNA vaccines have been studied for decades for things like the flu, for Zika, even cancer. And so we've never noted that there's an impact on fertility or pregnancy. No animal studies suggest that either, and these have been done for quite a while now. And then the final thing I'd like to say is we also just have to rely on what we know and science. So I'll say it again, there's no biologically plausible way for the vaccine to impact fertility. The mRNA and the other vaccine, the Johnson & Johnson vaccine, do not enter the cell's nucleus. Therefore, they cannot impact a cell's DNA. So for me to say that it's biologically implausible to impact fertility, even without the studies that we have and the data that we do have, I don't want to diminish these questions at all, but it's similar to saying I don't have any data that genes impact my fertility, but I can tell you that there's no scientific biologic plausibility that it can. So it's similar in that way, using kind of a silly example.
That's really helpful. I like the analogy. So for you and for Dr. Trivedi, we're seeing a lot of questions about fear to delay or long-term effects from the vaccine on their fetus and on us as women in general.
So one thing that is something that is a weakness of science is that pregnant women and lactating women have never ever been included in any scientific studies. So even Tylenol, there's no study and no long-term studies to show that Tylenol is safe in pregnancy. But we all know that Tylenol is safe in pregnancy, and it's something that we often recommend a woman take if she's having a headache or other, body aches, things that we know she needs something to take. She needs something for. And so similarly, the vaccine, although we, yes, don't have long-term data, we do know that from the data that we've collected, like Dr. Teague said, there's been, as of a month ago, there was 30,000 pregnant people who have self-reported to the CDC's program, and none of them have reported any effects or any effects from the vaccine, rather, that are different from the average population. And so the data that we have is encouraging, and we have to understand that the risks that we do have data for, we do have numbers to show about the risks in pregnancy. Getting the virus in pregnancy does increase your risk by threefold of being intubated, being in the ICU, having to be delivered prematurely, having severe effects to you and to your baby. That anything that we're seeing with the vaccine is far, far, far safer than getting the virus in pregnancy.
That's really good to know. We also have a question here from a pregnant team member who says, should I wait until my baby's lungs are developed before getting vaccinated?
I haven't seen any data that shows anything about a particular timing in pregnancy. Actually, what has more come out recently, speaking to what Michelle said earlier, that actually pregnant women who are getting vaccinated earlier are mounting more antibodies and have more antibodies circulating in their system to be able to be shared with their newborn. And so if you're going to get the vaccine, which we would encourage you all to do, the earlier you get it, the better, not only because you're protecting yourself for a longer duration of your pregnancy, but also you're providing more immunity and more protection to your newborn the longer that they're inside getting exposed to that the antibodies from the vaccine.
So earlier is better, and the vaccine does not impact my chances of getting pregnant, remaining pregnant, or having a safe delivery.
Exactly.
That is great news for all of us listening. We're going to shift gears slightly to another type question. Dr. Wachsmuth, this one's for you. Could the vaccine have any effects on breast implants?
There is no data to suggest that the vaccine has any effect on implants, and I will say what Dr. Teague said. There's really no plausible biologic or physiologic explanation that would suggest that it would. I will point out that we talk about the lymph nodes. Implants, silicone implants, we see enlarged lymph nodes on mammogram in women who have silicone implants. It's not anything worrisome. It's just a fact. Women with tattoos, we see enlarged lymph nodes. So just like that, the COVID vaccine can result in these temporary enlarged lymph nodes. So I just don't think that's really an issue.
That's good to know that other things could cause those enlarged lymph nodes, and it's important to let your mammographer and then, of course, your doctor guide you as the primary care provider.
Yes.
Great news. We're seeing a lot of questions here about the Johnson & Johnson vaccine and how we are recommending that for women. Dr. Greaves, do you have anything to let the team know about that?
Yes, a lot of media attention surrounding the Johnson & Johnson vaccine. A pause on this vaccine or halt on this vaccine was done recently because of rare blood clot formation in women. So there were 6 women that developed blood clots, but the vaccine had already been administered to 7 million people. So if you do the math, it was a very small percentage. However, for safety reasons, the vaccine has been halted and further studies are being done. The side effects, this blood clot develops around 2 weeks after vaccination. So if you have really severe symptoms such as abdominal pain, severe headaches, leg pain, shortness of breath within 2 to 3 weeks after vaccination, please contact your primary care doctor for further evaluation.
That's really good to know, Dr. Greaves. I see Dr. Teague has something to add.
Well, I think related to some of the questions that we're getting, I just want to echo what Dr. Greaves is saying, but also I think it deserves mentioning that, while we all are respective experts in our field and we are recommending women of reproductive age or otherwise get the vaccine, I would just like to mention that the major professional societies for reproductive medicine, so the American College of Obstetrics and Gynecology, ACOG, SMFM, the Society for Maternal Fetal Medicine, which is the High Risk Obstetric Society, and the ASRM, the American Society for Reproductive Medicine, which is my governing body. All of those professional societies are very strongly encouraging women to get the vaccine, women who are contemplating conception, who are pregnant, who are breastfeeding, all of those women, they're encouraging those women to get the vaccine. So I think that says a lot that it's not just us, but it is all the professional bodies.
That's really good to know, and that's hundreds of thousands of OBGYNs nationwide. So large endorsement beyond our panel here at Wellstar. Great to know. We're also seeing a lot of questions about what happens if I get COVID-19 because I have not chosen to be vaccinated. What happens if I get it during pregnancy? And then will I still be tested for COVID at delivery? And then what happens if so? Dr. Trivedi?
Yeah, so I think, so the question that says, will I be tested for COVID at delivery if you've been fully vaccinated? So just based off of the prevalence numbers that continue, we've sort of reached a plateau in the United States, but that doesn't mean that we aren't having new cases every single day. And so for the safety of our providers, as well as for you and your family, we are testing patients when they come in for delivery, regardless of vaccination status. Again, we know that the vaccine is even better than the original numbers, you know, up to 98% effective in preventing you from getting the. We do know that women most commonly, if they, or anyone most commonly, if they are getting infected after being vaccinated, have a much higher chance of being asymptomatic, not having the devastating effects of the infection. And so getting vaccinated, it's still in your interest, even if you end up developing the infection later, because it's going to keep you safe and it's going to allow your body to fight off that infection the way that you're now able to fight off a cold after being previously vaccinated or immunized against that.
That's a great point. So what happens if I do test positive for COVID at delivery? Dr. Greaves?
So Wellstar, and especially our obstetrics and gynecology units throughout the system, when this pandemic first surfaced, we, as a council and as a group, sat down and created safe nets to ensure that patients as well as the staff would be fully protected. And so once once detected, then we have the patients in very special rooms for delivery, regardless of whether it's a vaginal or a C-section delivery, rooms that are protected, rooms that are isolated just to ensure safety. The babies are also tested afterwards, and especially now that we have greater data regarding passive immunity to babies, we do not separate moms and babies unless mom is very sick and unable to care for babies. So we ensure that moms, as well as every staff, wear appropriate personal protective gear, wear masks, wash hands prior to handling the baby, and breastfeeding is definitely encouraged.
That's great news. We also have a couple of related questions about what happens to the baby after they're born. Are they monitored for a certain amount of time, and do they seem to be showing any respiratory effects?
The rate of vertical transmission is very low and very rare. Certainly babies are monitored and also tested. Our neonatal units at our Wellstar Hospital are absolutely amazing. Our nurses are also trained to monitor both mom and babies during these circumstances.
That's really good news. We're also seeing a lot of questions about people who are really nervous to get the vaccine because of the side effects. Is there anything that patients can do to mitigate some of those side effects we've all heard so much about, a sore arm, fatigue, or even a fever and chills?
So if any person develops these mild symptoms, certainly non-steroidals such as Motrin or Tylenol can be used to treat these symptoms. These symptoms are very transient and hopefully will go away shortly. But if after 2 days of vaccination, if the symptoms persist, please contact the primary care physician to address these symptoms.
Thank you, Dr. Greaves. How long can someone expect for those symptoms to last? And is there anything that we're hearing about a booster? We've got several people asking about a shot number 3.
So as far as the effects or the side effects from the vaccine, generally the data has shown that they last about 24 to 36 hours. So about, 1 to 2 days. Again, using, like Dr. Graves said, using Tylenol, ibuprofen, anything that you would to make yourself feel more comfortable, making sure that you are drinking plenty of fluids and resting. So if you're able to plan your vaccine around your work schedule so that you can have the next day off, then you're going to be able to just feel better, take it easy, and rest to get better from it. As far as a booster shot, I think at this time we still are collecting information regarding antibody coverage and how long that lasts in your system. It's important to know that the earliest people who were vaccinated in the general population outside of trials was only in December. And so at this point, we're just nearing the 4-month mark of people having been vaccinated. And so really the collection of data is ongoing for that. But there are thoughts that, similar to the flu virus, how the virus is able to mutate with new strains being increasingly infectious, that there is a possibility of needing a booster, or rather an updated vaccine from year to year. But it's just something that we're going to have to continue to keep our eyes on and wait for the experts to weigh in.
And I just wanted to add to Dr. Trivedi's point, it's really important for us to make sure as many people that can get vaccinated so that we can develop herd immunity. In addition to the fact that now you're hearing about mutated strains that are coming up, if we can get the number of virus down or very low, then that decreases the chance of mutating strains to pop up. And so once we have herd immunity, we'll have enough protection against those mutated strains. So that's what that's the race right now that you see, is the race to get as many people vaccinated so that we can end this pandemic. And even if we are at a new normal, still continuing to wash our hands and wear a mask, that it will, that we can still have a life and make sure that we decrease the number of morbidity and mortality surrounding this pandemic.
Thank you, Dr. Graves. We're also seeing a couple of questions come into the chat about women getting tested at delivery. Why are we doing that here at Wellstar?
So there are many, many reasons. COVID and pregnancy can be devastating. We have watched too many young women in our ICUs coming in undergoing preterm labor or placed on respirators and as they fight for their lives. So it's very important, even if women are asymptomatic, to get tested so that we can then be prepared in the event that they then become symptomatic and start having side effects or sequelae to the disease. Also, so that we can be proactive regarding our unborn patients.
And also for making sure that we're keeping our team members safe. So just because someone coming in may be asymptomatic and test positive, that doesn't mean that we are still getting data on how infectious someone is if they're asymptomatic, and if they're able to spread that to a team member or to somebody else in the community, and have that person actually get very sick. And so that's why it's still important to keep our testing going while we try to get more and more people vaccinated and get our new case numbers down.
That is fantastic news. I think it's really important to make sure we continue to protect our moms who are giving birth and their unborn children, but also everyone else in the hospital, their caregivers and the woman in the room next door. So very good addition for all of us to keep in mind. So Dr. Teagues, we have another question here about a patient who wants to undergo IVF. Is there a reason why she should delay taking the vaccine before she comes to see you about infertility?
No, there is no reason. I can't really elaborate too much other than what we've already mentioned. There's no reason to delay the vaccine. We actually actively encourage it.
That's a perfect summary. So get your vaccine today and then go see Dr. Teagues and her colleagues. To summarize, does anyone else have any points that we may have missed from their panel talk or from the questions that they want to add in for us?
I think one thing also to note is that all of us are here because obviously we believe in the vaccine and trying to get the vaccine out to our team members and out to the community, out to our female patients, and making sure that everyone knows about the safety of it. But we also acknowledge the concerns and fears that team members might have, but we would like you to urge you to bring those concerns to your provider, to have these conversations so that we can try to fill in the blanks and try to, provide the information that is out there, the evidence that is out there. Again, this is a new pandemic. Everything is ever changing. The CDC is putting out data daily that is continuing to change, but of the information we have, and that's all that we can speak to, we do know that the vaccine is safe and is highly recommended for all of our patients. And we urge you to have the conversations and continue this conversation outside of this forum with your providers.
Thank you, Dr. Trivedi. That actually answers the last question we just got in about where should I direct any additional questions. So I should send those to my primary caregiver who knows my medical history and can help guide me around what is correct and the best choice for me.
Absolutely.
Right. Well, that sounds great. Thank you. It looks like we've answered most of the questions in the chat, and we'll hand it over to Dr. Greaves to close us out on this exciting panel today.
So I want to thank all of the panelists, Samantha, and everyone, Dr. Waxmuth, Dr. Teach, Dr. Trivedi, and Michelle Riggs. This definitely is an act of love as service to our community to decrease this pandemic. We hope today's session has provided more clarity and understanding surrounding the COVID-19 vaccinations and women's health. Remember that it is not mandatory to receive the vaccination, but the best protection against COVID-19 is getting vaccinated. I also want to encourage you to continue social distancing, masking, and hand washing as we fight this pandemic. So this concludes our time together today. Thank you all for joining and have a safe day.